Hey, good evening. This is Dr. Florestan, aka Dr. Night Class. Thank you for joining us for another episode of Lamp Talk, where we interview residents and they reflect on challenges that they overcome throughout medical school. This evening, we're here with Dr. Walters. Can you go ahead and introduce yourself?
Yes, I am Dr. Walters, from Georgia originally, Columbus, Georgia. Decided to become a doctor when I was 17 years old. Went to Meharry Medical College. Now I'm here, a resident with fellow Dr. Florestan, internal medicine, both doing our thing, and here today just to help provide encouragement to all who's watching.
Thanks, Dr. Walters. Thanks for being here. We have a few questions here for Dr. Walters as a PGY2 physician. Let's begin. How did you navigate the heavy burdens of balancing academic demands with your personal well-being?
Well, first year in medical school, um it was kind of a struggle because I was trying to get used to the workload as you suggested, and just the pace, and that large amount of information that you have to absorb and regurgitate like on a week to week basis, with weekly, well, not weekly tests, but bi-weekly tests, different organ systems and things like that. So first, I had to gradually get used to the workflow that was required in medical school, to be efficient with studying and things like that. And then after, like, I developed a process of, how I learn and learning how I learn, and like becoming more efficient with that. Then I was able to, start incorporating, things that I used to do prior to medical school, like back into my life, like, trying to hit the gym more often, go for walks in the park. I like being outside a lot, go catch movies, reading books like that, and just like adding those in here and there, and then gradually, like, I started developing a balance. Now, I wasn't as balanced as before medical school, but it was still something that would keep me preoccupied outside of medicine. So, I don't lose that, like, I don't lose myself in the process, and I still stay like balanced and have that like being grounded, so I still remind myself of who I am by engaging in those activities that I love to do. So that's kind of like how I learned how to balance the workload with my personal well-being.
Right. And that's a wonderful answer. Kind of not to lose your identity, being in the midst of such like a high academic load and, finding those areas to just rest and reflect and go back to, you know, your authenticity. So I appreciate you sharing that, Dr. Walters.
Welcome.
So the next question, what was the biggest disadvantage you felt you had compared to medical student classmates?
Well, I would say this is more geared towards some classmates. Now, I know a lot of classmates, myself included, had a few gap years prior to medical school. And in between the time from college to medical school, quite a number engaged in like master programs or post-bac programs that would like help, catch them up with the curriculum that was needed for medical school, or master programs that would have medical school level curriculum. So when they got to medical school, they were seeing the information twice. And for me, I was seeing the information again. I was introduced to it in college, but medical school is a different level. So I feel like that would have helped me. So that kind of was a disadvantage. And also just personal, like I learned more so one-on-one as opposed to the classroom environment. And I feel
Mhm.
like when you get that one-on-one teaching from the professor, it helps connect more, because in college I used to go to office hours all the time, and that's where the bulk of my learning would come. Like I would use the class as like an introduction to the material, but I would
Mhm.
really hone in on the material when I would tailor specific questions for the professor of things that I didn't really quite understand. And like I would learn more in those 10 to 20 minutes with the professor than I would
Mhm.
learn in like a 1 hour and a half session in a classroom environment. So I feel
Right.
like that was kind of, I wouldn't like a disadvantage, but yeah, that's what I
Mhm.
learned about myself, basically.
Yeah.
So yeah.
Yeah, and it sounds like a classic hurdle that students have to overcome being like functioning at like a speed of like undergraduate and transition to graduate level, and especially like such large work volumes and everything coming at you so fast, increased amount of test exams. And then,
Exactly.
I also appreciated, those who got some degree of post-bac program, master's, PhD. They're used to that graduate level intensity.
Exactly.
And then
Exactly.
also, being in graduate program, some of these programs, they have like a high volume of students,
Mhm.
so it'd be
All
one
the research
lecturer
environment.
and
Yeah.
yeah, yeah. So that's kind of like a default, especially if you're coming from, you know, um, undergraduate program that had like small classroom sizes.
Hmm.
So is that how you felt like it kind of felt?
I mean, yeah, for the most part. I mean, I went to, I would say a medium sized college. So I did have like quite the number in my classes, but it was more so like major related classes. Other classes, it would be small, some would be big. But yeah, for the most part, it was quite the transition. But I mean, I adjusted. But I feel like the adjustment would have been a lot smoother if I did like what I've mentioned before. Maybe try the master's program just to get myself mentally prepared for the work volume that would be required of me in medical school.
Mhm.
But hindsight is 2020, and I still made it, so everything worked out.
Right, 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 right. So can you name like a skill that you had to acquire as a medical student that didn't come easy?
A skill that I had to acquire. Okay, I would say the skill that I had to acquire that didn't come easy was basically knowing what was important and knowing what wasn't as important. I'll
Mhm.
call it more so not selective learning, but just being able to delineate what were the concepts and facts that I needed to focus more on than others. Because in medical school there's a lot of volume. You have less amount of time to actually absorb it, because the tests come like constantly, like it's like a series of tests. In
Right,
college I prided myself on knowing like the details of everything, but then I
right,
realized like in college it was less information with
right,
more time. In medical school is more information with less time, so I really had to prioritize what I need to focus on. And
right,
that was basically acquired to going to class, seeing
mhm,
what the professor harped on the most, going
right,
to outside, additional supplementary learning sessions that were provided by, like PhD students or the teacher assistants to
mhm,
see, and like just learning from that, and then being able to tailor my studying. So when I test day, I wasn't surprised by like concepts that were more present on the exam as opposed to others. So I would feel more like prepared in that sense. So that
right,
was a skill I had to acquire. And I didn't fully grasp that skill in the first year. It actually took some time. I didn't really get it down till my second year.
right, right, right. So it sounds like, initially you hit that wave of what's relevant, what's not relevant, and we like to call it like what's test questionable, what's not test questionable, and sounds like for what you're saying, you're able to learn how to sift through the things with the help of like TAs and professors and things of that nature, practice questions also.
And upperclassmen too as well. I mean, you show
Hmm.
up to medical school, you have your M2s or already took the class before you, so they can give you some tips and helpful,
Right,
strategies. So yeah.
right, right, right. I think that's a very, really common struggle that even in like anatomy and physiology, students study to become anatomists rather than, clinical medical doctors. And, um, it definitely it's appreciated when upperclassmen help, guide them away to what's clinical or guide them towards what's clinical. Um, Very good. Okay, so last question: can you share a specific moment in residency that reinforced your passion for medicine and validated your decision to become a doctor?
That's a very, very good question. So a moment in residency that reinforced my passion for medicine and
Hmm.
basically, you know, made sense of why I chose to be a doctor. Um, I would say actually this year. because first year I was mainly trying to survive. Is when I had a patient show up, and they were concerned. It was a young patient. I will stay anonymous, because of HIPAA and everything. But I believe early 20s. She was pregnant. Had some painless bleeding that morning. Was really concerned about the health of her baby. So I went through my differentials, and I was actually studying this topic a week or so prior to, and I discussed the case with the attending, and I mentioned placenta previa because in the first trimester of pregnancy, that's one of the common causes for painless bleeding. So we did a transvaginal ultrasound, and that ended up being the case.
Right.
So
Right.
being able to uh, basically use my learning and seeing it, effective in real time, and being able to educate the patient, on this current situation and provide reassurance, you know, to where she's comfortable and she understands what's going on, and just being able to coordinate the care and let her know the steps to take, and then communication with her OB-GYN and close follow-up and things like that. Just being able to tie the learning with like real life medicine, like reinvigorating me. And then that reminded me why I chose this profession. I mean, we're interested in learning, but the learning is useless if you're not able to use it to help others. And when I was able to connect the two, that's like what basically reinforced my passion. So I would say that moment.
Right. 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 Well, Dr. Walters, I appreciate you taking time to do this lamp talk, and it's going to go to good use as it'll inspire other medical students that are going through it right now and paying their dues. And appreciate you stopping by.
For sure. And I just want to encourage all the medical students watching this to, keep up the good fight. I mean, this medical school or medical journey in particular is a long one. I mean, there's ups and downs, but you just have to stay grounded. Just keep reminding yourself why you're in it, and just know that if have good intentions and you put in the work, that it will work out. And just know that Dr. Walters is behind you every step of the way. So yeah, I just want to leave with that parting message. And yeah, that's all I have to say about that.
All right. All right. Thanks for your time, Dr. Walters. All right.
No problem.